name is Victoria Palmer.
Alex Vasquez. Aaron Moxley.
Lindsay Moxley.
Justin Palmer. Andrew Palmer.
Christine Parkes.
Preston Scott Parkes.
Hi, my name is Dana Palmer. Today I'm going to be telling you guys about breast cancer. The key to finding breast cancer is early detection. As you can see here, knowing it exists is never enough. Today I'm going to inform you about the way to find breast cancer with early detection and pass this information on to you. Check your lumps for bumps. That's the first way to find out. A pill a day will keep the doctor away. 1 in every 8 women will get breast cancer in their lifetime. That's a high number. Breast cancer, along with skin cancer, is one of the highest cancers in the world today. The first thing that I'm going to be telling you about is the way of doing screening for breast cancer in early detection. By the National Breast Cancer Foundation, they say to do monthly breast exams. Someone around the age of 20 should start doing monthly breast exams. You can find this at many different resources in order to do monthly breast exams. This is a way for you to find out if there's any different lumps that you feel within your breast. Some people may not be able to feel a lump, so therefore it would have to be detected some other way. At the age of 20 to 39, most women would need to go and have a clinical breast exam, meaning that they would need to actually go to a doctor and have a doctor examine their breast. Every 2 to 3 years is when this would happen. At the age of 40, most women will go and have a baseline mammogram done. A mammogram is basically an X-ray of the breast that shows the breast tissue in the breast. It actually takes a photo of the breast and determines if there's any tumors or any lesions in the breast tissue. Between the age of 40 and 49, most women have this done once or twice a year. Like I said, around the age of 40, they will do a baseline breast mammogram on the breast. Depending on what they find, you will either have to come back once a year or twice a year. Around the age of 50, every woman should have it done once a year. There are 2 different types of breast cancer. There's non-invasive breast cancer, which is called in situ, which means that it stays in place. What in situ breast cancer or non-invasive breast cancer does is it stays contained in the place that it is found. By the Mayo Clinic, they say that the most common non-invasive breast cancer is the ductal carcinoma, which means that it's in the milk ducts. Non-invasive breast cancer is one of the least evasive breast cancers. It is very much the very highest known breast cancer. Invasive breast cancer means that it moves to the surrounding tissues in your breast. The cancer cells travel through other tissues in your body, such as your lymph nodes and such as that. There's 5 different stages of breast cancer. The first stage is stage 0. Stage 0 is found in your non-invasive breast cancer, such as that breast cancer that was found in your milk ducts or something like that. That stays right there. Stage 1 means that it has not spread to any other breast tissue, that it is the tumor is the size less than 2 centimeters, and that it stays right there, that the breast cancer has not moved to any other tissues. Stage 2, there's two different conditions for it to be classified as stage 2. The tumor is less than 2 centimeters, and it has also spread into your lymph nodes. Stage 3, the tumor has to be larger than 5 centimeters, and the cells have also spread into the lymph nodes or other tissues around the breast. Stage 4, the cells have spread to other parts of the body, and most of the time it is actually spread into the bones. There are several different treatment options that most patients with breast cancer can have. There's a lumpectomy, meaning that the person can choose to have the lump actually removed, and whenever that is done, the lump is removed, the tumor is removed, and excuse me, the tumor is removed along with the breast tissue around the tumor, and the doctors make sure that they remove a marginal area to where they feel that there is no more cancer cells around that area. Or they can actually do a mastectomy. A mastectomy is where the whole breast is removed in order to try to remove all cancer cells. And also a centennial mode biopsy, which is a centennial mode biopsy is where they actually take the lymph node out, and they dissect it and make sure that there's no cancer cells within the lymph node. And if there's any cancer cells within that lymph node, they will actually do an auxiliary lymph node dissection, meaning that they will go in and take out more lymph nodes and check those lymph nodes to make sure that they are getting all of the cancer cells out of those lymph nodes. After you have a choice of the surgery options, there is several different radiation and chemo options. Radiation therapy is a high-power beams of energy, examples like X-rays, that actually are put into your body to kill the cancer cells. An external beam radiation therapy is sent into your body, and it's used by patients who've had the lumpectomy in early stages of breast cancer. A brachial therapy is radioactive materials that are put inside your body, and is used for more patients that have had the mastectomy or larger cases of breast cancer. Chemotherapy is a drug that is used for breast cancer patients to stop the cancer cells dead in their tracks. This has been a really good drug that they have used. There's been a lot of research for breast cancer, and they have found that breast cancer has been one of the highest cancers that they have had the highest rate of the cancer stopping dead in its tracks. Of the people not necessarily being cured from breast cancer, but have been cancer-free for many, many years. Also, hormone therapy, blocks the hormones that could possibly cause cancer. Some cancers are caused by hormones that makes the cancer grow, meaning that cancer is caused by something that makes it grow. Something actually causes the cancer to grow. Hormones can be one of those type of triggers to cause it to grow. So now that I've educated you about breast cancer, let us review. We've talked about the early detection, the two different types of breast cancer, the invasive and non-invasive. We've talked about the different stages of breast cancer, stage 0, stage 1, 2, 3, and 4. And we've talked about the different treatment options, the surgical treatment options, the radiation, and the chemo. Now save a life, guys. Grow your wife and save the tatas. Thank you. I hope you enjoyed my speech.